Hi, my name is Steve Hodgson. I'm Director of Hallamshire Physiotherapy in Sheffield. Today I'm going to talk about knee pain, and specifically pain on the outside of the knee, lateral knee pain, which is we commonly see in runners, but you can see it in other people who are not running, but for this I'm just going to talk specifically about runners. Knee pain is not uncommon in runners, and they often present with a problem in the knee that's usually come on as they've changed training. So usually they brought in different terrains, started bringing in hill work, or started to run longer distances, usually training for half marathons or marathons, after running normally sort of 10k distances. So changing activity, changing levels of training can be one of the sort of causes to why these problems come on. Now, when you look at the pain's usually on the outside of the knee, which commonly is referred to across here. Is the outside of the knee here. This is where the iliotibial band inserts and goes into the lower tibia. However, it tends to be caught along the epicondyle, which is the outside part of the femur, which gives this sort of localised pain. Now, that causes a flicking, and often runners will describe like a flicking or a local pain over that area. And usually they've had lots of treatment over here with varying degrees of success. There's a couple of things to consider before we think about treatment, but with a runner, often these problems, there's not an inflammatory component to them, so taking anti-inflammatories is usually of limited benefit. It's often mechanical. They run for 5 miles, after 5 miles they get the pain, the more they run it just gets increasingly sore, so then eventually have to stop. As soon as they stop, give it a rest for a few hours, the pain goes. Walking is often fine. So it is the sort of mechanism of running. So how you run is critical. There's a couple of points you need to really consider before you just view iliotibial band as a sole cause. As a general rule, you want, as a runner, to have the most efficient running style. If you're hitting the floor hard, if you're impacting through the floor, that stress is being taken by your joints, your knee, hip, your back, which doesn't make you run efficiently, and more importantly, it will cause stresses on certain muscles and joints, which can cause problems in certain people. As a general rule with the runners, I want them to be able to lean forward. I want them to be able to take their centre of mass forward, so they're actually dropping as they run. If you've got a very upright stance where you bounce, you tend to put more pressure through your knees, which creates more stresses around your knees, which can long-term cause problems. So you want an action where you're dropping forwards, and I like people to be hitting sort of foot reasonably flat, so they're actually getting a rolling forward and not hitting heels excessively, or conversely landing on the toes. If you start to land on your toes and develop a bouncy type running pattern, that tends to create problems in my experience. So you want a foot flat, leaning forward. So think of like a ski jump position where you're leaning forward from your ankles. You're still upright, you're still looking in, but it's a dropping. That way, as your centre of mass is moving forwards, your legs are dropping, which makes you more efficient and reduces some of the impact through your knees. So that's what I would talk to mainly about the runners. In terms of the pathology with the iliotibial band, once people start to get lateral knee pain, yes, they will get soreness on the outside of the knee, but what I would always look for is why they're having particular problems around the outside of the knee. Now, there can be other causes to lateral knee pain, such as compression of lateral meniscus can be an issue, so the cartilage can compress. It can also be referred pain from the back. You can get the sciatic nerve comes around the outside of the leg, and that can refer into that area, and the head of fibula, which is a little bone on the outside here, which is here, you can see this is the little bone on the top, that can be an issue as well, so that can get sore depending on how you use it. So you can get problems around the head of fibula. But if we're going back to the iliotibial band, I would say one of the biggest problems is that people start to lose hip control. They tend to lose hip control and pelvic control from the lumbar spine, often causing an increased medial rotation of the affected limb. This tends to then produce co-contraction through the iliotibial band, which then increases the stress on the outside of the knee. Invariably, when you're trying to deal with this, you want to look at how the alignment of the leg. You want the knee to be going straight through, so the kneecap should be going through, straight through into the second toe of the foot. You should get a good rotation. Once you start rolling your leg in, if you start to roll the leg in, you tend to increase the stress to the outside of the knee, which tends to cause additional stress through the lateral part of the knee. So invariably you want to get better hip control. If you have a tendency to roll in or excessively out, you're more likely to get in problems. So you've got to look at the alignment of the leg. That is critical. I'm not a massive lover of core stability. People get this idea they have to get stiffer and get stronger. It's not as much stiffness, but it's how you control your trunk over your pelvis, which often the cause of the iliotibial band problems. Local treatments and stretching will give you some temporary relief, but unless you address what you're doing above the knee, from my experiences, you'll often find you don't get long-term resolution of the symptoms and you struggle to get an increased mileage, or you can't return to running for various reasons. So as a general rule, look at how you run, look at the pelvis, look at how the knee alignment is, but specifically look at the control around the hip. Additionally, you also have to consider what's happening with the foot, because if people tend to roll the leg in, they tend to find they tend to pronate onto one side. Now, orthotics can be useful in certain cases. However, before you're rushing at orthotics, I would always advise runners to change how they run. Often by changing how they run, you'll change the alignment of the knee and use the muscles to actually get a better alignment. And from my case, 9 times out of 10, you tend to find you will get rid of this through just learning to run in a different way and change it. Hope that helped. If you need more information, please do not hesitate to call me or go to Hallamshire Physiotherapy at www.hallamshirephysiotherapy.com for further information. Thank you very much.